Hi, this is Steve King with you once again. Today I'm going to be discussing something called pyroluria. Now, pyroluria can cause lifelong anxiety, noted Joan Matthews Larson. Now, some of you may know of her. She a very famous author and a PhD. She notes that pyrols are worthless byproducts of red blood cell production, and that most people have few of these in their blood, but some people have elevated levels which cause problems. Pyrols are elevated in 11% of so-called normals, 25% of disturbed children, 30% of schizophrenics, 40% of psychiatric patients, 50% of alcoholics. Now, pyrols cause a loss of vitamin B6 and zinc. A deficiency in vitamin B6 and zinc is what causes the anxiety and depression. A lack of vitamin B6 leads to a deficiency of dopamine and serotonin, which causes the anxiety and depression. So let's look at the signs or potential signs of pyroluria. 1. Do you have white spots or flecks on your fingernails? Do you have opaquely white or tissue paper thin nails? That's number 2. Number 3, are you a nail biter? Number 4, do you have poor dream recall or nightmares? Number 5, are you becoming a loner as you age? Number 6, do you experience nausea or prefer not to eat breakfast? Number 7, does your face sometimes look swollen while under a lot of stress? Number 8, have you been anxious, fearful, or felt a lot of inattention since childhood, but maybe successfully hid this from others? Number 9, do you have bouts of depression and or nervous exhaustion? Number 10, as a child, did you get a stitch on your side as you ran? Number 11, do you tend to focus internally on yourself rather than on the external world? Now, pyrols can be measured with a simple urine test. There is one testing center, the Biocenter Lab, which is in North Hillside, Wichita, Kansas. And a person could even phone Jim Jackson. He's a PhD. I think that's 316-684-7784. And don't forget that Joan Matthews Larson also notes the urine must be sent properly or you're wasting your time. So please be aware of that. If you ask your doctor about this, my guess is she says they will tell you this is complete and utter nonsense. But they probably do not know much about this, so therefore assume it is nonsense. But as the Nobel Prize-winning chemist Linus Pauling said, when your colleagues aren't up on it, they're down on it. So remember, when they figured out that bacteria causes ulcers, most doctors said this is complete and utter nonsense. So remember, when they figured out that homocysteine was in fact an independent risk factor for heart disease, most scientists actually said this is complete and utter nonsense too. So anyway, I would suggest that remember when they told doctors to wash their hands before even delivering babies because there was something on their hands that maybe was infecting the mothers, most doctors said this too was probably nonsense. So not trying to make too much of a point of that, except to say it is well worth checking out. If anxiety has remained present for you, if depression has remained present, just check that out. So I would ask you to consider getting this checked out for yourself, and please test this theory for yourself. And when you realize that if pyroluria is in fact causing your anxiety and depression, antidepressants like Prozac and Zoloft cannot possibly help because they have actually nothing to do with this. And this was noted by Joan Matthews Larson. She's a PhD, and it was noted in a speech she gave, I think it was probably 2007. And for 30 years, in fact, she had been treating addiction, anxiety, and depression with natural supplements. And that was in order to correct the underlying biochemical problems which cause these conditions. She is very well known as an author of a great book called 7 Weeks to Sobriety. She's also authored Depression Free and 7 Weeks for Emotional Healing, so I would urge you to also check those out. But again, pyroluria, well worth checking out just in case. That's at the bottom of anxiety or depression for you. Thanks very much. I'm Steve King.